Okay.
Good afternoon, Dr. John.
It's okay. I'm ready to go.
Welcome to another episode of the Biosonics podcast.
Yeah.
And here we are in our new little setup. This was an adventure.
Yep. A great adventure. I like it.
Yeah. So we're here to talk specifically about quantum cranial sound healing. Now that's a mouthful.
Yeah.
So I guess we can start by just saying what exactly is quantum and what exactly is cranial and what exactly do they do together?
Right. Well, I think probably to get to that, I should start where I began with it, because I didn't. It's a mouthful, and we go back to 1974. I'm head of the child adolescent ward at Bellevue Psychiatric Hospital in terms of therapeutic interventions. And unknown to me, there was a ward hidden within the ward, right? In that ward was children born to addicted mothers who were in incubators, which was hidden, basically. And I had only maybe 3 months before met Dr. Arthur Lincoln Pauls at a special workshop, and he was head of the British Osteopathic College Academy. I didn't know what it was, but I was in search at the time of a way to touch people psychotherapeutically that would be softer and easier to deal with than more pushing into people's body, causing pain and so on, which is popular in the 70s. So I was looking for a softer form of touch. It is recommended I go to this man, to Arthur Pauls, and I did. And during his talk afterwards, he brought me back in a room, and he did cranial work on me, what's called osteopathic cranial, where he touches the head, and I was just taken away by it. And so I only studied with him maybe 3 or 4 weeks, because he's going to go back to England, so I studied a lot real quick. And I still didn't understand it at all, except for, theoretically I knew the anatomy, but still the clinical part of it was something that was easy but not easy in a way. But I knew how to touch the head, I knew what I was doing to some extent. And he had left, and I found this ward. And so I went in and I decided I'd experiment with all those little babies. Well, the thing was that nobody cared about those babies. There was one nurse in the room, the doctors that went around. To see them was breathtaking. They were all shriveled up. They weren't eating. There was problems. And so I went around to each incubator and I did cranial work on the little babies, and right away, literally, the nurse jumped up and could see the results. I saw the results. They started to move. They started to cry a little bit. They started to do things that they wouldn't ordinarily do. So every day when I went back in to see the children, I found the back ward. I went back in and worked in them. Within 3 or 4 days, they were starting to eat. They were starting to, take nourishment. They were beginning to look less wrinkled up. They only weighed a few pounds. And they were less anxious because they were born addicted. So that convinced me of the power of that particular approach to healing. Not the theory or anything like that, just the direct clinical result. So I decided I would study it more in depth. And from there I studied more with Lincoln Pauls. I went to England to study with him. I came back and I studied with the osteopaths in America. And I then studied with Dr. Upledger later. I studied with regular osteopaths and Upledger. So I really spent years studying this particular approach to healing. And I began to realize that when it came to sound and the cranial, that it could be done rather quickly. And in the context of sound healing, it wouldn't be more medical or anything like that. It wouldn't be necessarily that I'm learning to use it as a touch therapy per se. I could integrate touch, but it could be learned in a way that would be most appropriate and very efficient for sound healing. Because I started to use it with my autistic children, all my patients, as part of their sessions with the tuning forks. So
at the time when you were doing the cranial work on the infants, were you already doing sound healing with tuning forks? Had you already discovered?
Oh, yes. Yeah, that I'd already discovered, but that was next to impossible to do when they were in incubators and things like that.
Right.
And so I was just working with this one healing modality that I could. It gave me access with my hands. I always say our hands are tuning forks also. So in cranial, when you learn the approach, your hands literally are tuning forks, and your skin hears as good as your ears. So you're using touch and tuning forks in a way of the same thing. And I always thought that the cranial was frequency based. When you tune into certain frequencies. The osteopaths talked about this too. They called it the primary respiratory rate, and the more mystical osteopaths called the pulsation or the tuning, the breath of God. So they got it's an approach that begins to transcend normal medical. But the osteopaths, for me at least, got caught up in medicine, whereas I began to see more of a vibrational aspect of it in my work. And again, my work was not as an osteopath, it was as a psychotherapist in the hospital. So the complexity of it, I want in this class to go to the basic principles, to make it simple, so that sound healers can begin to understand what sound does based on its effect with the cranium and also the spine and the sacrum, and to see that system and how to use sound healing to work with it.
So you want to give people who don't have necessarily experience or knowledge of anatomy, they can use, or we can use sound to work with the cranium in the same way that you were using your hands. I mean, we could use our hands as well, but to be able to use sound to do this type of cranial work that you had discovered.
That's correct. They'll use sound. I'll teach also how to use your hands, but not at the level of using your hands, say, as an osteopath. And we're not going to do the level of anatomy I learned. I don't think it's necessary for sound healing to know that, but we are going to learn basic anatomy that we would need to locate where we're at on the cranium or the spine. So, and most people kind of know that anyway. I'm not going to get into a lot of complexity, but we want to learn basically the bones of the cranium and how they move. And this is another controversial topic, because when I was doing my anatomy training at New York University Medical School, the head of the anatomy training, I was learning the cranial too at the time, and I said, I met this osteopath that said the bones of the cranium move. He said, no. I go, oh, I forgot. He said, there's no way they move. But I wanted to argue because I wanted to get through the course, so I said, I didn't say a word. But the bones actually do move, but they move very minutely. We might call it a homeopathic movement. And the medical profession think that's meaningless in a way, but the cranial osteopaths think that means a lot. So a little, can either mean, you can look at it as nothing, or you can look at it as something. And I often give the way I compare that is, if you're going down the road with the radio, the old radios with a dial, and you're listening to rock and roll, and you just barely touch the dial, barely touch it. The next station could be Chopin. Right? So you could go from Guns N' Roses to Chopin, literally like with a little touch. So that to me is the cranial. It's just a little touch, little movement. And as the osteopaths claim, that will affect the whole body. But again, I want to say it's not just the osteopath. That's been claimed for thousands of years. The osteopath, a man named Dr. Sutherland, gave us insight into the anatomy, but the actual use and approach to the cranium, there's thousands of them over the years. In fact, the one religious symbol that transcends all religion is the halo around people's heads and the aura and the head. The ancient kings and queens put on crowns on their head. Those crowns are anointed. They have crystals, and they get insights into other intuitive aspects of how to rule their kingdom. In fact, they're not even a king or queen until they're anointed with their crown, and so on. There's nothing new about this, and I want to say that it's important that many people have studied, I know, in the field of bodywork, cranial, and they're welcome to come to class, because even though I've studied from the beginning, with a whole different way of seeing it, right? A whole different way of thinking about it vibrationally. And the word vibration is where the word quantum comes from, right? Because the word quantum means to quantify vibration. So now what we're going to do is quantify vibration with tuning forks and apply it to the cranium and the spine and the sacrum.
Okay. So just to get back to the movement of the cranium has different, like if people can imagine when they see in their textbooks, a skull and it has those sutures.
Right.
So you're saying that each one of those pieces has little bits of movement in relationship with each other. So there's a couple of quadrants of the cranium, and you're saying they have slight movements, which can be a huge difference in your reality.
Yeah, absolutely.
Just the
Those
same way.
Slight movements can have to do with migraine. They can, in fact, the founder of the osteopathic cranial work made a helmet where he tightened up his bones, and he kept track of all the problems he was having when the bones were locked into place by his helmet. And he published it under the name of Bonehead Bill. That was the good old days. And I think if it's possible in our podcast, if you could see the cranium I have, that cranium, you can see the bones pulled apart.
Okay, so here, you want to grab it?
I don't think I can. You want me to hold it?
We can explain it for people who are just listening.
So if I hold it here, I could look at the camera. So this is an expanded cranium.
So we have a cranium and it has different pieces.
Right, and you'll see your forehead.
The front piece, yeah.
And you'll see the top of your head. You'll see the back. And those have names. We'll learn the names like frontal, parietal, occiput. And where your ears go in are right here. It's called your temporal bones.
That's the side.
Right, and there's a bone underneath that goes all the way across. I'm going to pull it out because it's hard to see. I think I'm going to pull it up. There we go. Here, we're taking a little dissection here. He didn't want to let go of it. There we go. And I pulled this out. And I'll hold it up. And this is called your sphenoid bone.
So the sphenoid bone.
I think you lost a wing somewhere, but this is sphenoid bone.
It looks like a winged creature.
It's like a butterfly. And it has wings. This is called your greater wings, your lesser wings. And this area right here is called the sella turcica. It means the turkey's saddle. This is where the third eye sits in our consciousness in the body. It was called the seat of consciousness by the ancients. So we have the sella, and the sphenoid is literally wanting to fly. So as the bones open and release, the sphenoid literally, like a butterfly, wants to fly up and go. The ancient would say it wants to fly to heaven, and then it comes back. This is what I talk in some of my classes was called ascension, and it comes back.
But not physically. But you're saying even the slightest movement of the bones can feel like flying or.
Oh yeah, these bones
ascending or descending.
Yeah, these bones are very far apart. They're just to show what happens. But in reality, they're so close. These sutures are called sutures where the bones are at. If you look at it from this angle, you see they got little cracks and lines.
Yeah.
If you took everybody's cranium and you took the skin off, you would see that every little line and crack is different. And I like to say this is when we were born, this is where God signed us. Right, he was a doctor probably. Sorry.
The messy signature.
Yeah, but every cranium is different. Just like your fingerprints are different, every cranium is different. But there's this ability of the bones to literally open and close.
So it's like compression and decompression.
Decompression, expansion, contraction, like a heartbeat. And so that's the tuning of it in a way. So they can go freely. And when they're caught up for some reason, or they're compressed and they can't decompress, you would say that this particular bone, the sphenoid, can't fly. It's pushed down, it's compressed. And I always said there's the same compression and decompression are the same thing. Psychotherapeutically, depression is a form of compression.
Okay.
Yep.
Mm-hmm. So you're saying if you're compressed meaning in terms of your cranium, and what we're talking about is the lack of movement.
Yeah. It's a symptom of depression.
Okay.
If there's a compression like that. And that symptom can also cause physical problems. And it's also, but psychotherapeutically, I associated it more with mental challenges and depression.
Mm-hmm. So it's interesting because people don't really believe, I think, that's such minute, like what you were saying, your doctor from the 70s didn't believe that the cranium moved.
The doctors still don't. Most in fact, most osteopaths don't either. It's only the cranial osteopaths that think that.
But you would think that by this time there would be some tool or barometer or something to show that it does move.
Well, there is. There's research showing there's minute movement in the cranium. Minute.
But people just don't believe that it does anything.
Exactly.
And you're saying absolutely it does, and it's your experience?
Well, I always go back to the little babies I worked on. Maybe you could say it's from something else, or whatever. But I've worked with this since 1974.
Yeah.
50 years of working with the cranium and so on in this way. And both as a cranial expert, meaning a master of the cranial approach itself and body work, and mapping that into sound work so that sound healers could learn how to use it in their own particular way.
Okay, here you go.
Yeah.
So, let me just put this back. The teeth fell out. So how does it work?
Well, it works with the vibration. Basically, it's the clinical mechanism is really quite simple. For example, if you have tuning forks and you take them and you tap them and you're moving them around the head like this, mm-hmm. right? Most people will do that. They'll tap and they'll move like so on. That vibration is coming out of the tuning fork and bouncing off of the cranium itself.
Okay.
It's setting up a pulsation already. When that pulsation of the tuning fork, especially C and G, is aligned with the basic structure of the human body, then you're going to have a resonance that will take place. It reminds the body of what balanced would be.
So to me, that means that your body naturally, what you said, resonates
yes.
with the interval of a C and a G.
Yes.
That's a fifth.
Yes.
And since your body naturally wants to be there, when you hear that interval, your body, in a sense, will remember to go back to the natural flow.
It goes back to its natural flow, or what's called neurologically neurocoherence. Mm-hmm. Right? It just wants to.
Right.
Right. And so therefore, there's areas in the cranium, the bones are moving in the correct way. We can learn with the forks to tap them either together or just on your knees. And you just can learn those movements with the forks and be a little more precise as a sound healer about working rather than just moving around the head. Mm-hmm. Many times people watch videos of me working and I'm moving around, they see me go like that or like that.
Right.
I'm doing
kind of like Tai Chi moves.
Like Tai Chi moves, but then I'm doing cranial moves too. Mm-hmm. So we have to learn a cranial protocol of the moves with our hands. Then we map it to the tuning forks, and then when you're tapping, or you could use, if you have pyramids, people put pyramids over their heads.
Right, those crystal pyramids that make
pyramids,
sound.
Yeah.
Mm-hmm.
But the tuning forks are extremely versatile for doing this, and there's many different ways to do it. So the class really starts with how to do that. Just simply with C&G, tapping, and knowing the movements and how to work in that way. And then we go down the spine to the sacrum. And then the last part of class is really going in the brain itself to see how the brain moves with that movement clear to its core.
Wow.
Yeah, and then when we get into the brain core, we begin discussing something called cerebrospinal fluid, which cerebrospinal fluid is a saline fluid that's in your brain. It cushions it and so on, but deep inside the brain there's reservoirs of it. It looks like the Great Lakes or something like that. And these reservoirs of fluid, what the osteopaths called the fluid, the cerebrospinal fluid, the highest known element in the human body. And so we're going to look at cerebrospinal fluid and how vibration repatterns it. Very much like it puts a vibrational pattern that the fluid takes on, like a Cymatic picture.
Yep.
So you're dealing with water taking on vibrational patterns, or messages in water. It's the same thing. So the fluid takes this pattern, and the fluid circulates clear down, up and down the spine to the chakras, and this new vibrational pattern is able to move through the system that way. And that would be the essence of the class. How do we get things moving? Then how do we vibrationally repattern the cerebrospinal fluid to be most congruent for to go with C and G and perhaps other intervals?
And just for those of you who don't know what cymatics is, it's the study of
vibrational patterns.
How sound affects
matter. Actually, how the sound affects matter, and how sound creates different vibrational patterns, and how those patterns can affect, basically in our case, how they affect the body and what they mean.
I think probably most people at this point have seen these patterns on water, especially. A lot of people, like, you put a vibration into water or a plate and it goes into these geometric patterns, which is quite unbelievable. So the thought of that we are so much water and we're in the cerebral spinal fluid, that it's making patterns is just, it's
not only making patterns, but it's the ability to create new patterns. In other words, we have neuroplasticity, but we also have water plasticity, right? Meaning that we have to, that every time a frequency changes, it sends new patterns through our system. And those patterns are basically locked not only to the cerebrospinal fluid channels, but they go directly into the connective tissue channels. So those vibrational patterns come into a crystalline environment, that's resonant with the whole system, and they instantly transfer up and down into the body. It's amazing when you think about it.
I mean, it feels like even the way a river starts as a little trickle in a mountain, and it just has a cascading effect. Down,
or the wind hits the water, causes different patterns, and so on. Or it hits rocks and bounces different patterns. So our goal is not necessarily, we got what I call a tuning pattern, right? That's your C and G. And then we want from the tuning pattern to be able to adapt and change to trillions of different patterns and always find our way back to the tuning pattern. So,
which is the foundation of
Biosonics.
All the classes is this everything. Concept. And it's just the way, what I love, again, about all the classes is it's the same message and you're just coming at it at a different angle.
From different therapies, different perspectives, and I've never ever changed my tune with that either. All you need is C and G and the Auto 128 with a 15 millimeter crystal, and that's a complete sound healing system. And within that system is every tone that I sell, basically. But if you want to bring them out for variety,
then you take class.
I don't think anybody believes me, but it's true. I've never changed it, never. And so now we would use this in the cranium, and I'll show you how to use other tuning forks, how the crystal tuner and so on works. And especially we'll look at the auto tuner,
which is the weighted tuning fork with the weights on it,
with weights, and
that
the
makes a vibration.
On the bottom. And we're going to see how, if we put it at the base of the cranium, or definitely on the spine, how to put it on the spine or the sacrum, how that begins to make things move again and pulsate. Right. So if any course shows you these three tuning forks, the C and G and the 128, are a complete system. Right. And then we can learn how to use that for ourselves and for others. You can learn how to use it at home with people. You learn how to use it if you're a doctor, therapist, nurse, whatever it may be. Integrate it into a practice. It's universal. When I originally started, I was only going to teach doctors and therapists, but then I realized it's universal, and all of us can just take this sound and go into it.
Yeah, I was telling someone the other day, I think you had mentioned you did intend to teach it to doctors, but they weren't as receptive as just regular
not only were doctors,
layman people.
Not only were doctors not accepted, but musicians weren't receptive either. So thank goodness you don't have to know a lot about music or medicine to make it work. So I got lucky. Right?
Yeah, that's really interesting.
Yeah. But there were many doctors that have become receptive. At the time, there were too. That supported me a lot, and musicians too. My first class was done for 3 people. I thought only composers I need to teach this to. 2 couldn't deal with it, and the third one, all these years, is still with me. So it's but now things, from the time I started over 50 years ago, things have changed drastically, in the field. I haven't, in a sense. Same thing I've been saying all these years. And my job in the classes is really just to show you how that integrates into other healing approaches so they can be combined and worked with. And if you're a sound healer, per se, then I think that it would make you a little more precise in the way that you're thinking, without having to study other healing arts. But if you're a nurse or doctor, it's to be something you could add to what you do, especially a psychotherapist. We have a lot of chiropractors in class now that are adding this because it's so quick and efficient, and it's universal.
I come from the perspective of just kind of like the regular person on the street that is so stressed, right. Or students or anyone who just can use this quote technology to have some kind of balance.
But that's exactly who I target now. Mm-hmm. In the beginning, I targeted doctors and nurses and therapists to give it to the people in the street, and now I said I just take it right to everybody, and I let go of the technical language and all that and do my best to explain it, not only in terms of modern science, because I'm a doctor, I know my science, and I especially focus on system science, but I also know my mystical and my religious things, so I will integrate it with ancient knowledge, shamanistic knowledge, and so on, because it's universal. It's been in shamanism, it's in Hinduism, it's in Christianity, Muslim, Buddhist. It goes on. Every system uses sound, and sound is a modality of enlightenment, and insight. But I do my best to really explain those languages, not in mystical terms or religious terms, but in science terms. Because science is neutral. And I'm not there to tell anybody what to believe, what to do, but I want people just to know that there's a commonality in science that cuts through all religions and so on.
Yeah. Is there any example or story you have? I mean, besides the infants of doing this work that unlocked people, or? Oh
yes, Remember, I've done thousands of sessions with the cranium and so on, and sound and psychotherapy, and basically most people, when I started doing this, they're not even spectacular stories. People come in, and if I forget to do at the end the tuning forks with a little touch into cranium, they would just stop and say, "Wait a minute, you forgot to do that."
Meaning, so you would just introduce it in your regular psychotherapy sessions. You would do this little special thing at the end, and probably didn't say much about it.
I didn't say not a word. I just did it.
Oh, you just did it. Okay. And then they would be like, "Wait, you forgot to do my
little..." You got to do that.
And okay.
And then they wanted more of it. And so then my sessions were originally 50 minutes. The psychotherapist called an hour 50 minutes. So much for time. And so I did the psychotherapist hour, which is 50 minutes, and it's all supposed to be verbal work. But I began integrating touch into sound, and only for like 3 to 5 minutes max at the end of the session, right? And it guaranteed that every person would come in and say, "I want more of that." right? And then I realized the powerful effect it was having on them, because the issues they came, I knew what they were, and they would resolve a lot quicker. And then I went from the 50 minutes to a half hour, and I was, in a half hour, even a lot of people were coming 15, 20-minute sessions, and they were getting results like really good. So in fact, as far as I'm concerned, you can do 3 minutes or 2 minutes like I did originally.
Yeah. Well, we have TikTok time now, which is basically 30 seconds.
30 seconds is even
20
better.
seconds.
TikTok is great. And my wife Thea, she's a dance therapist and a trainer, and she learned it from me. And she was doing it with her people she had trained physically. And afterwards, they just sort of lay down and to rest, and she would do the tuning forks and the cranium, a little bit of the cranium. And she got mad at me. She said, none of them want to exercise. They want to lay on the floor and they want to get those treatments. And she wasn't the only one that came in and said, like everybody's asking for more. So I was happy to say I could understand why. I definitely could. And I spent a long time trying to get psychotherapists and therapists to adapt this in their practice, especially the touch and the sound. But it's so far, it's little by little, it's making big inroads.
Well, it sounds like you just need less of the. People you want to talk. People do want to talk, but maybe it takes less time to resolve.
Oh, less
issues,
time, yeah. They resolve them.
Yeah.
They get off the table, and I know what their issues are. And I knew that I could talk about this for 3 years, and all of a sudden you see things just passing through, and they come back and things just are starting to resolve. I don't think it's a miracle or anything like that. And at the time, I wanted to investigate it further. And that's what I've done for 50 years. I've got the research, I've looked at it, I've written articles in professional journals, I've published at a very high level, because I'm that dedicated to it. And at the same time, I'm bringing it to as many people as I can who aren't therapists, who don't need to be therapists, who can learn how to use it in their life as well. That's why in my classes, there's so many people who learn from the beginning, and there's people who are very advanced in all my classes, because they always pick up something they can integrate.
Yeah, and people who've taken the classes like myself for many, many years always come away with something new.
Yeah.
Even if you've told the same story a million times.
Exactly.
It just hits a different way.
The story is I tell her only in the context of the healing art at the time that I want to demonstrate, the principle. Mm-hmm. The stories are about principles in action, and that's it. So there's levels and levels to them, so you begin to process it differently. And
just go, what you often say about what quantum, because quantum time, quantum distance, you say there's really, you could do remote, you can do cranial remote
totally
work where you're not even physically with the person.
Yeah.
And is that, would you consider that to be like quantum?
Yes.
Because it's vibration.
That's entanglement. Once you're there, you're entangled. And the quantum
meaning
part,
once you tune in to someone, you're quantum entangled, even if you're not physically. Yeah,
physically there. And what's physicality anyway?
Vibration.
It's vibration. So once and again, this is the progression of science. I think noetic science, for example, I'm a systems scientist. We're looking at this bigger picture. And of course, you like the bones don't move kind of thing. They move and that doesn't mean anything. They're little. Versus the consciousness is in the brain, but now we're beginning to understand consciousness may be a fundamental aspect of the universe that permeates everything, and of course, and that's part of the cranium, because you think we're going to look at the brain, and what does it do, and part of the quantum part is we're going to look at what's called microtubules. It's the cytal structure of neurons, the skeleton of neurons, made up of crystalline structures, and those structures carry more memories than all the hard drives of the world. You're talking about so much information that's available.
I love, that's my favorite thing, is the microtubules, the crystals in our brain.
In our brains.
Because it's not hard to know that that's true, or to think that that's true, because computers are crystalline in nature. And so if our body's crystalline in nature, then there's information stored. It seems like obvious.
Yeah, it's obvious. Yeah. It's becoming more and more obvious. And the amount of information we have, not only, but our brain now is just in our head, it's all the way down, the neurons into our gut and so on. So we have this immense amount of information available to us, but we can only access it through coherency. Mm-hmm. So if the bones are all tight or twisted, that's a form of incoherence, a decoherence, you might say. So the body is up like this and twisted and held tight. Yeah, and psychotherapeutically, that's body psychotherapy. So if somebody walks in and they're like this, it's one thing to be like that and let go. Good athletes could do all kinds of stuff, or yogis. Another thing to be like that and totally forget you're like that and tighten.
Yeah, which is everybody.
Yeah, and that creates a dissonant understanding that you begin to see the world through. It's like glasses you're looking through. Right, and it could be here.
I like that. Your body is a lens. I never thought of it that way. Your body is the lens that you're looking through.
Yes.
So if you're tightened up, you're seeing life
a tight world.
That lens. Yeah. Well, I can relate.
Right. All of us can relate.
Ask my family.
Yeah. Well, all of us can relate, because we all know when we're uptight. In the 60s, you're uptight.
Absolutely.
And we have words like that. You're uptight, or these are words just the saying that you're like that. And there's a discernment of it can be very subtle. And I think it's my philosophical view is that that tightness is something that's constantly releasing at subtler and subtler levels. But every time it releases, the tightness is chaos, and it releases, and we come to a new order. But again, I think that's going on for trillions and trillions of years. There's no stopping it. It's just how do you relate with it. And so I like to say chaos is my friend. Otherwise, I'll never get out of it.
Yeah, that's excellent advice. So what was the inspiration for, how do you decide to teach this? Because there's so many angles.
Well, I decided that the quantum cranial I teach because it's so powerful for people. It's once you understand it and once you apply it, it's something it's all sound healers and people using sound can do, and it can become both very intuitive, or like it would probably be more intuitive the way I teach. Even though to be anatomy, it will talk about brain neurological structures, but it's going to be primarily you can do it intuitively, right? And but again, people who come to class that have lots of cranial, and by the way, I took all kinds of anatomy and I dissected brains. I did all kinds of stuff to figure this out. Then I realized it's all not necessary in a way, not for what sound healers need. So I've taken all of that, and then I was even more surprised that all the cranial people were so overloaded with all this stuff. They were so happy the way I taught it because it helped them have new insights into all the dissonance they had with all the memory and the cranial anatomy they had to learn. Mm-hmm.
To me, I think that must be so nice to actually know all that stuff, and then to have this experience of really letting it flow. Yeah. I almost have a desire to know a little bit of anatomy.
Well, I do. Basically, it's the anatomy is it goes on forever if you want to learn it, right? It's like it's a theory in a way and there's different approaches to anatomy. So I'm not thinking so much medical anatomy as I'm thinking a little bit more vibrational anatomy, and I don't want to overwhelm people. I don't overwhelm people with mathematics. I don't want to overwhelm people with anatomy or music theory, anything like that. I want it to work. Mm-hmm. And I think a lot of that's because I'm from a place in the United States that things are very simple. Well, that's the way it is, boy.
Oh, you're saying were you from in Indiana?
Yeah, that's.
It works. If it works, it works. That's
if you're looking
nobody's questioning.
From any place in the world, Indiana's a bunch of farmers, and everything's like a farm thing. So I want to make things available to people and explain it in a way it's understandable and applicable. Rather than say go to university for 8 years and figure this out.
Nice. Okay.
Yep.
Any last words?
My last thing is this: this is fun to teach. It's fun to know. And you'll come away with very, very practical skills that you can use, and an understanding that's both extremely old. It goes far beyond what we call normal modern osteopathic cranium. We're going to look at the history of it from Swedenborg, clear back into India. We'll look at the ventricles of the brain, what we call the pathway of ascension in the body, and how that relates psychologically to euphoric stress, and what we call flow psychology. We'll put all this together and try to update it for this. The most exciting thing is we're going to update all of this into our modern times for our modern needs. That's my goal. Yeah.
Perfect. Love it. It's all about getting back into balance.
Yeah, exactly. Be coherent and
coherence.
Yeah.
Which there's a lack of, but we get back.
It's easy to get out real quick, right?
Okay. Great. Well, I'm excited.
Good. All
Thank
right.
you.
There's a podcast.
Yay.